In this session, we're going to do an overview of the Health for All Advocacy Toolkit. Weiss was going to give us a little background about the toolkit. I'm just going to go through the different parts of the toolkit, and then when we go into the sessions, that's where you're going to do a deep dive into part 3 of the toolkit, which focuses on the different steps for advocacy planning. With that, I'm just going to hand it over to Weiswa so he can start with just giving us a quick introduction. Weiswa, let me know when you want me to share my screen.
Sure, sure. Thanks, Liana. You can put the screen on. It's fine as I speak. I want to thank the Global Health Council for continuing to champion the cause of equity and UHC. UHC is often presented as a technical term, and so I want to start off by just giving a simple definition of UHC, which is that it's the aspiration that all people can obtain the health services they need of good quality and without suffering financial hardship. And so you see all those parts, equity, access, quality, and affordability really at the core of the UHC agenda. UHC is grounded in the values that all people have the right to health. And the pandemic has really made it very clear that health for all is not just a radical idea, but rather an essential goal that all of us should aspire to attain. Um, the thing about UHC is that it holds great potential for all of us, regardless of what issues we work on, people who work on HIV or TB or the NCDs or mental health, and also just the broader sustainable development goals. All of that is part of UHC, and so there's a lot of potential in this big umbrella of UHC. But I want to now talk about why and how we developed the UHC Health for All Advocacy Toolkit. Just to give you some background, the idea of developing the toolkit came about back in 2019 in the lead up to the United Nations High Level Meeting on UHC. And CSM wanted to create a tool that will give civil society and advocates the information and resources they need to advocate for action on UHC at the country level. So the CSM hosted advocacy sessions with civil society and communities at the country level to get a sense of what they needed. And it became very clear that what was needed really was knowledge and information about UHC, but also about the global health advocacy initiatives and platforms and how they work. In addition, we developed and shared a survey with our members and the broader CSO networks to get more input and to get a better understanding of the kinds of information and resources that CSOs would wish to see in the toolkit. And more than 100 people and from 40 countries responded and really indicated that they wanted some practical tools and guidance for UHC advocacy. Some of them provided really specific input on what they wanted to see, and all of that was incorporated into the toolkit. And lastly, we scanned existing toolkits to see if there was a tool that was already developed, so we don't replicate our work, and so we found really nothing specific on UHC, and so this tool was developed with input from the broader society partners, and it was a very inclusive process. Um, in terms of what we really wanted this to do is we really wanted it to be a tool to build capacity, to inspire and mobilize civil society at the country level, and also to help advocates understand the concept of health for all and take practical steps to incorporate it in UHC into their work. The toolkit aims to provide advocates with a one-stop access to key information and tools they need to make the case for UHC and hold leaders accountable, as well as build a social movement within the civil society in support of UHC. In a minute, I will hand over to Ariana to walk us through the different parts of the toolkit. But I wanted to say that in 2019, when world leaders met at the UN high-level meeting on UHC, they endorsed ambitious commitments and targets for achieving UHC. But all the data we are getting now shows that we are off track, and the COVID pandemic has really pushed us even further away, and we're going to need to do. We have so much work to do to get back on track. We all have a role to play in this, especially civil society. We have a bigger role to play, and next year, 2023, there is an opportunity for us to, you know, raise our voices at the UN, the second UN high-level meeting on UHC, to demand action on UHC from the leaders, and also to influence the whole process before even the UN high-level meeting when world leaders will meet. So there is hope that, and there is opportunity for us to continue pushing this agenda forward. But we are going to start now to do that work, and all of us to take this very, very seriously. Now I want to hand over to Aliana to walk us through the different parts of the toolkit. Thank you.
Thank you so much for that great introduction, Waiswa. Okay, now I'm going to actually take you through the toolkit. The important thing about the toolkit is that you see we have home section, which talks a lot about what Waiswa mentioned just now, what the toolkit is about, a quick introduction, talking a little bit about what you'll see in the toolkit, how we define universal health coverage. There are three key parts to the toolkit. Part one is an introduction to universal health coverage. So it's almost a 101 about universal health coverage, its history, why it's important. Then you have part two, which is why civil society needs to engage in universal health coverage. And part two is really similar to what we've been saying in the plenary yesterday and what Elisha mentioned this morning about why it's so important for civil society to push these different issues that we discussed in the plenary, and any other universal health coverage or health access or health quality gaps that you see in your country. We all have a role to play, governments, donors, multilateral agencies, and civil society as well. And you all as civil society play a key role. So this section is all about how civil society can take this into their hands and strengthen their advocacy. And then part three is all about how can you participate? So step three is what you'll be going through in more detail in the sessions, and it's a step-by-step approach to advocacy planning. So that's the home page. You can toggle the different parts down here, and you can also select them up here. We have a key resources page which has a glossary of terms. You're going to see a few terms that are highlighted throughout the toolkit, and it's all in our glossary here, so you can always reference it back here. And then we have, again, information about the toolkit. We have a feedback form. This is really important to us at the Civil Society Engagement Mechanism because we want to continue to hear from our audience about how helpful or not helpful this toolkit is, if there is anything that you might suggest to make it stronger, if there's anything confusing about the toolkit that you think we should simplify. that's an opportunity for you to provide us with your feedback. If you need any kind of technical support, please feel free to contact us. Our information is here. And if you know about the Civil Society Engagement Mechanism of UHC 2030, also known as CSEM, but you want to learn more in depth about the activities and how you can actually be a part of CSEM, you can go ahead and click here and it'll take you to the main CSEM website. I do want to also highlight that we have this entire cool toolkit with all of its resources available in French and Spanish as well. So you can toggle up here to select which language you prefer to go through the toolkit with. So that takes care of all of the different features of the toolkit. I'll just go quickly into part one. You'll see that part one talks about what universal health coverage is, how it works, why do we need UHC, a brief history, and the UHC landscape. I'm just going to click here so I can show you what the page looks like and how you can navigate through each part. So this is part one of the toolkit. What is universal health coverage? These are all the different sections that I just named. If you click on the different section, you learn all about universal health coverage, where it came from, how it's defined, progress to date. I should also highlight that we do have actual examples from different parts of the world of successful aspects of universal health coverage to kind of make the concept more concrete to our users. So feel free to take a look at these case studies, these country case studies, to further understand what it actually looks like in practice. Just to say, you can also toggle up here with how UHC works. This is a really important aspect of universal health coverage. It covers health financing, service delivery, and governance, and each of those sections are discussed here in this section, so you can have a better understanding of, in practice, how UHC works. Why do we need universal health coverage? As Weiss was said, I think the COVID-19 pandemic has really showed us why it's so important to have universal health coverage, to make sure everybody has access to testing and treatment and vaccinations. So UHC is really something that I think right now in our context is incredibly important. We have, some points here to make as well, and here's a specific box on COVID-19, discussing the importance of UHC in this context. Also interesting is to see how UHC actually supports and affects all of the other SDGs. So you can get some more information about that here. So it actually is a very cross-cutting issue. This is one of my favorite pages, a brief history about UHC. And this takes you through a timeline of universal health coverage, when it first appeared, all of the different events or initiatives that have been pushed since then to further universal health coverage. And it takes us all the way to the present. So really cool. You can read more about each of these different events and initiatives or key moments. But basically, it takes you all the way through the history of universal health coverage. And then the UHC landscape seemed to be really important to a lot of the civil society organizations that we met in country. They really wanted to understand the connection between universal health coverage at the global, regional, and national level. So we added this section to kind of explain that. And you can see we have a map here where you can actually click on different parts of the world to see universal health coverage and everything that's happened in the different countries and everything that's happened in the different regions. You simply just click here, and then you have the global events that have happened. That's part one. If you go into part two, this will take you into the role of civil society. So your role as civil society organizations in achieving universal health coverage. So here in part one, we discuss, why it's so important for civil society to participate in UHC beyond just service delivery. There are so many different aspects of universal health coverage that civil society has an important role in. So you can learn about that here. Here are some examples of what civil society has achieved throughout the years, different things that civil society can do to really make a change in universal health coverage. This, I think, is a really good place for you to reference when you start thinking about in your sessions. And then beyond that, when you go back to your organizations and you develop your advocacy plan, what is that change that you want to make to fill the problem in your country that you would like to solve? And this can give you some ideas. It could be legislation, it could be advocating for more budgeting. So here are all of the different aspects that you can learn about. And then we also have some country examples down here. And then here are some key advocacy messages that we actually created with the help of civil society organizations that you can actually incorporate into your ongoing advocacy. Leave no one behind. What does that mean? What are we asking for when we say leave no one behind? Increase public financing for health. Again, why is it important to increase health and what do we want our governments to do? Improve involvement of citizens, transparency and accountability at all levels. Why, we need to make sure that governments are engaging with us. And in the paper that we discussed yesterday in the plenary, the GHC publication on the health impacts of COVID-19 on those left behind, one of the major recommendations and points that we try to make is why it's so important for civil society to be involved in addressing this pandemic, in addressing gaps in universal health coverage. You all are in the front lines. You truly know what the issues are. And really, you need to be heard. And a lot of our panelists were talking about claiming your right and your position in furthering, and responding to COVID-19, furthering universal health coverage. So we address that here also as a main community advocacy message for you all that you can use. And then supporting our health workers, also very big and very important. UHC 2030 as a platform also has key asks that they pushed during the high-level meeting on UHC in 2019 and have continued to push since then. So here are some other advocacy messages that you can borrow from that I think are important. So I think we're coming a little bit close to time. I don't want to go through part 3 in too much detail because again, you're going to actually take a deep dive into almost all of these steps, not all of them, but the key steps here on how you can go back to your organizations and develop an advocacy plan. I'll just take you quickly through the steps and then I'll leave some time in case you all have questions. But the first step, obviously, is defining what the problem is in your countries, and you'll be going through this in your sessions into these spreadsheets and these resources. The next step is identifying who can really help you make that change. Who are the decision makers? Who are the influencers? Who are the people that can be your partners, that can be part of a coalition to further your initiative? Then you have who can join. So this again is what I was referencing in terms of who are your partners. And then the next step 4 is what are your advocacy asks. So we do provide some advocacy messages for you in part 2, but you'll definitely want to create your own advocacy messages based on the problem and the change you want to make in your own countries or regions. And so this takes you through how you develop those impactful advocacy messages. And then it actually provides you a tool with how you can actually create your advocacy plan and how all those prior steps help you piece together what it is you're going to do and how you monitor what you're doing to make sure you're making an impact. Many of you probably already have budget templates in your own organizations, but one of the steps that I think is missing a lot of the times when organizations do advocacy planning is budgeting for it. It's going to cost money to do all of that advocacy work. So making sure that you have a budget to know and understand what type of investment you need to make and get money for. So we have a budget template here. It's very simple that you can use. And then the final step is how will you know that you've been successful? And this is all about creating simple monitoring and evaluation plans to make sure that as you implement your advocacy planning, you're actually making the impact that you want to make. So I'm going to go ahead and stop sharing my screen now. Weiswa, if you don't mind coming up again. And I just want to check really quick to see if we do have any questions. It looks like we don't. You are going to be able to ask tons of questions in your sessions. I think for now, the instruction I'll give you all is if you can go to your sessions, you will see that your session will appear on your screen. So I'm just going to share my screen again, actually. I just thought it might be good to show you in case I know some people yesterday were a little confused. So this is what the landing page of our platform looks like. And right now you're in the stages. So when we're done with the plenary, all you do is you click here in the session and your session will appear on the screen and you simply click your session and that's how you'll join. If you have any issues, I emailed you all yesterday with your team names, and in that email, you have your co-facilitators, which are CC'd. So feel free to email your co-facilitators if you're having any issues with joining your session, and they can send you a direct link to that. We will have 5 sessions. Each session is going to have a lead and a co-facilitator. So you're going to have plenty of support. The lead and co-facilitators are seasoned advocates. So please take this opportunity to learn from them. Don't be shy. This is a workshop. It's not a panel. It's going to be a discussion between all of us. Ask questions, offer examples from your countries. Then you'll get to network after, so you'll get to know each other even better. Weiswa, any points you want or advice you want to say before we split into our sessions?
No, just do it the way we do it in advocacy. Share your knowledge as much as possible because we're all here to learn from each other. And so this is the opportunity for that.
Awesome. Thank you so much, Waiswa, and everybody have a great session. Just remember, at the end of your session, you want to come back to the plenary so that we can talk about the microgrants that we mentioned in the save the date and invitation for this event. So if you want to learn more about the microgrant process and how you can submit a proposal for a microgrant, please come back to the plenary at the end of the session so that I can go through that and provide you with that information. So I'll stop broadcasting now and I will see my team in our sessions. Happy workshopping, everybody.